My name is Albia Altine Gibson, and I am the Managing Director of Racial Equity Grant Making at Health Resources in Action. We want to just welcome all of you to our webinar announcing the 2022 grant making cycle of the Massachusetts Community Health and Healthy Aging Funds, also known as the funds. Health Resources in Action is a nonprofit consulting organization serving government, nonprofits, philanthropy, and communities across the US. Our mission is to help people live healthier lives and create healthy communities through prevention, health promotion, policy, and research. Next slide, please. I'm joined today by my colleagues, Emily Breen, Program Officer at HRIA, and Chen Chen Hens, Grants and Program Coordinator at HRIA. Next slide. Here are our objectives for today. First, we hope you will gain a better understanding of the background and rationale for the Massachusetts Community Health and Healthy Aging Funds, including our priorities of racial and health equity, policy systems, and environmental changes or PSE. We also hope that you will have an understanding of the upcoming funding opportunity, including due dates, key processes, and available technical assistance too. Just to note, if you're not able to apply to this grant making cycle, that's okay. There will be other opportunities in upcoming years to apply for the funds. And just very briefly, in the chat, if you could share your name, organization, and the funding stream that you are interested in applying for, just to get a chance to introduce ourselves, but via chat today.
I'm Jack Kelly from HBSS Connect Corps in Lowell, Massachusetts, and I'm interested in the Mass Community Health grants.
Thank you for sharing, Jack. And if folks would please respond also in the chat, as we have a good amount of folks on here today, just to give everyone an opportunity to share their name and organization as well. Thank you. We'll go over through the next slide, please. This session will be a total of about an hour. And first we will share background and rationale to provide further information about the funds. We will also share more details of the approaches that we're looking for, and then discuss a bit of the grant making process and next steps to both apply and engage with us as we move through this funding opportunity. And I want to again continue to thank you all to please share your info in the chat. Next slide, please. Just a few housekeeping logistics to share with everyone. Before we launch into the content, if you have any logistical questions related to the webinar, please type into the chat box. We also want to be sure to answer any content related questions that you may have, so feel free to type them in the chat box as well. Answers to all generalizable questions raised will be available on the frequently asked question page on our website following this session. And the webinar recording, slides, and transcript will also be available as well. We will now begin with an overview of the funding opportunity, just a bit of an at a glance. On here, we just essentially have outlined the different funding stream, the amount of years that you can receive funding for, as well as the funding amount. Additionally, the grant start period, which we have as August 2022, eligible applicants, activities, the deadline, which will be June 17th, 2022, as well as contacts through the Mass Fund email and our website. We will also share more of this information, but it's also available on the website as well. Next slide, please. Now to start on the background and rationale. This grant-making opportunity disseminates resources through the Community Health and Healthy Aging Funds. And it's made possible by a partnership established between the Massachusetts Department of Public Health, or DPH, the Executive Office of Elder Affairs, or EOEA, and Health Resources in Action, or HRIA. In January of 2017, the Department of Public Health completed a landmark revision of the Determination of Need regulations, which led to the creation of the fund. HRIA serves as a fiscal agent that is responsible for facilitating and planning the implementation of the funds. HRIA was selected through a competitive bidding process for this particular portion of the funds. And DPH oversees the fund. EOEA makes decision in partnership with DPH and provides expertise regarding the Healthy Aging Fund. Next slide, please. In terms of thinking about the purpose of the funds are committed to disrupting and removing barriers to health, structural and institutional racism, poverty, and deep power imbalances through community-centered policy, system, and environmental change approach. We provide the resources to enhance the capacity of multi-sector collaboratives to really authentically engage residents and work together so that everyone in Massachusetts has the highest quality of life possible. Next slide, please. In 2019, 2 advisory committees were established to guide the overall direction of the fund. The funds come from hospitals, long-term care facilities, and other healthcare facilities. And we'll share a bit more about that at later on in the presentation. Resources are directed to 3 funding streams: 2 community health funding streams, which focus on policy, system, and environmental change, or PSC, and community health improvement planning, or CHIP, and 1 healthy aging focused funding stream. Next slide, please. So when we look at the community health component, the vision established by the advisory committee is that all Massachusetts residents have an equitable opportunity to achieve the highest possible quality of life. And this vision essentially aligns with DPH's goal to eliminate health inequities through addressing the social determinants of health. To work towards realizing this vision, we invest in community-centered approaches that are intentional in addressing root causes of inequitable health outcomes. The focus will be on populations that experience inequities. And we will focus on geographic areas in Massachusetts that have not benefited from local determination of need funds in the past. The next slide is for the Healthy Aging Committee, and the vision that they developed was equitable systems across sectors affecting community level physical environments and social and economic condition, ultimately leading to a better quality of life and health outcomes for older adults as they age in Massachusetts. And to work towards this vision, we will invest in strategies that focus on 8 domains of age-friendly communities, emphasizing, again, the social determinants of health and funding of policy, system, and environmental change approaches. And you'll hear a bit more about that shortly. Next slide, please. So what is the Determination of Need program? It is the result of healthcare institutions, as we mentioned before, such as hospitals and long-term facilities, who enter into an effort to expand or improve on their facilities. And so a percentage of that total expenditure of the overall cost for that particular project is invested into the funds. Next slide, please. This map of Massachusetts provides a visual of the projected local determination of needs related dollars over the course of the next 12 years. So this slide is point in time going back from 2015 into 2027. Next slide, please. This map shows the geographic reach of our initial cycle 1 awardees. And so in this geographic area, this is the reach that the awardees from the 2020 grant making cycle received funds. The creation of the funds will allow for distribution of resources in Massachusetts to communities that have not historically benefited from the termination of need investment. And as you can see with this map, the funds allowed for a larger reach throughout the state of Massachusetts. Next slide, please. So why are we doing this work? So thinking about the overall intent of the funds, the goal of this effort is to advance population health in Massachusetts. And we know that 80% of what influences our life expectancy happens outside of a healthcare system. And it further highlights the point that where we live, where we're educated, where we work and play have a huge impact in our ability to thrive. Next slide, please. So what do we mean when we talk about health? A visual here that depicts, this visual depicts the concept of a tree. This is the foundation behind what we are doing. Imagine the leaves being depicted as negative health outcomes. The visual here displays the leaves as a number of poor health outcomes that we see in Massachusetts and across the country. And so some of these health outcomes include COPD, cancer, behavior problems. But we also know that these health outcomes do not stand alone and are not generated by themselves. The structure that supports these leaves are branches. And in this context, the branches will represent individual behaviors that can be modified, reduced, or increase one's risk of developing poor health outcomes. And so these behaviors include smoking, substance use, stress, etc. And we know further, when we look at a tree, it consists it doesn't consist of just branches, but also the trunk. And the trunk here represents the social determinants of health. Built environment, education, rates of violence or trauma, for instance, all impact the health behaviors, which then impact health outcomes. And furthermore, when we look at the roots, which are the foundation of the tree, in this context, we see that structural and institutional barriers influence how we experience social determinants of health, which then again impacts health and people's health and lives. And some of these structures include racism, classism, and much more. And finally, when looking at the underlying systems, this is a concept we talk about called groundwater, which in this image, along with the soil, represents underlying systems of dominant cultures and narratives. And we live in a racially structured society, and that is a cause of, and we live in a racially structured society, and that is what causes racial inequities. So when we think about the health of the tree or the health of a community, it's important to look beyond the surface and beyond, it's important to look beyond the surface pieces, such as the leaves and individual behaviors. And it's very important to look at and understand the root causes of these issues, which is what the grant seeks to do. Next slide, please. So as we discuss all the factors that influence one's ability to thrive, it's important to define what we mean when we say disparities or inequities, and to make a distinction between the two. We see disparities as differences between individuals or population groups. We see inequities as differences that are unnecessary and avoidable, but are also unfair and unjust. An example of that, people with darker skin are more likely to die from melanoma, even though they are less likely to get it. This disease is often found in later stages in dark skin, and the lack of images in what melanoma looks like in dark skin, education, and accessibility for screening levels is part of that disparity. And it's really important to the work of the funds because the fund seeks to focus on and address inequities. Next slide, please. It's also important for us to define health equity. So here is a definition that the advisory committee for the funds adhere to and utilize. The term health equity is defined as everyone has a fair and just opportunity to be as healthy as possible. To achieve this, we must remove obstacles towards health, such as poverty, discrimination, and deep power imbalances, and their consequences, including lack of accessibility to good jobs with fair pay, quality education and housing, safe environment, and healthcare. It is important that as we consider advancing health of population, that health equity is at the center of our work, especially with the funds. Martin Luther King said it quite well when he addressed the Human Rights Commission in the 1960s, where he stated, of all the forms of inequality, injustice in health is the most shocking and the most inhumane because it often results in physical death. And that is the portion around the why and the rationale for the funds. And now I'm going to turn it over to my colleague, Emily, to talk a bit more about the grant-making approach.
Thanks, Albia, and hi, everyone. Thank you so much for joining us today. I'm going to be sharing a bit more about how we work towards the visions that Albia was talking about earlier in the presentation. So the overall funding opportunity, one of the things that makes this opportunity unique is the core tenet of policy systems and environmental change approaches. We really see this as an important piece because we believe these approaches have the greatest potential to impact some of the root causes of health that we were mentioning earlier through that health tree visual. Here on this slide, we share, as you remember, the overall goal of the funds is to disrupt and remove barriers to health so that all Massachusetts residents have an equitable opportunity to achieve the highest quality of life possible. So we do that through our strategy of multi-year investments in and capacity building for community-centered approaches that are intentional in addressing those root causes of inequitable health outcomes. And we do that through 3 funding opportunities: policy systems and environmental change, CHIP, community health improvement planning, and healthy aging. So I'll talk a little bit more about each of those 3 funding opportunities in just a minute. On the next slide, if we reflect back on the health tree visual that Albia shared, we had the trunk of the tree where those social determinants of health were. And so on the left side of the screen here, you're seeing 6 common social determinants of health: the built environment, education, employment, social environment, housing, and violence. These are 6 common social determinants of health that DPH has prioritized. However, they're not the only areas that you can focus on. You're welcome to focus on any of the other many social determinants of health. On the right side of the screen, we also highlight some health outcome areas. Again, these are areas that DPH has prioritized, but they aren't the only ones that you can focus on. But these include substance use disorders, housing stability and homelessness, mental illness and mental health, and chronic disease. On the next slide, I'll talk to you a little bit about the policy systems and environmental change funding opportunity. And again, we'll just try to provide a brief overview of these 3 funding opportunities. Later, we will have a separate session for each funding opportunity to learn more if you'd like to join those. So the policy systems and environmental change approach is not only a key concept of the funds overall, but it's also a specific funding opportunity. And approaches can range across a variety of the social determinants of health, like I was just mentioning, or the health outcome areas, as long as they're working to create PSE change. So here we have an example of the PSE change versus a programs approach. So just this first example here, I'll talk through it. We see a programs approach being potentially hosting a community bike ride. It's a valuable but one-time event, whereas a PSE change approach might look like implementing a complete streets policy to ensure community roads are designed to be safe and accessible for all users. And the key difference here that we see is that this is really a longer term, more sustainable approach that could potentially impact more people. So there's a few other examples here on the page, but we just wanted to highlight that distinction for you all. And just really quickly, PSE awards can range between $50,000 and $200,000 per year for up to 5 years. And so on this next slide here, we have a few examples of currently funded PSE projects. We wanted to share those examples with you. This is just meant to be illustrative. It's not an exhaustive list of the approaches that you could take, but 3 examples we have here are addressing housing instability and barriers to healthy living for residents through the development of a new building, which includes affordable housing units and several other resources like a grocery store or pharmacy. Another example is addressing food insecurity through establishing a food policy council or developing and enacting urban agriculture policy in a municipality. And the final example is intervening at the level of decision-making in institutions to craft more inclusive structures that welcome people most impacted by health inequities to be involved in the decisions that directly affect them. So again, these are just a few examples. If you'd like more information on our current grantees, you can visit our website. But also we encourage you to be creative and create approaches that are distinct for your individual communities as well. The next funding opportunity I'll talk about is the community health improvement processes, or CHIP approaches. And so CHIP is, you can apply for any of these stages of CHIP that are outlined here on the screen. And I won't read them all, but want to just highlight these, that they span across anywhere from doing a community health assessment to actually implementing the strategies that were developed through that assessment. And so again, want to highlight that communities can apply for any point within this process, and CHIP awards can be between $10,000 and $75,000 per year for up to 5 years. On the next slide is a few examples of our CHIP funded projects. So the first one is implementing a community wellness plan through sustained coordination, as well as capacity building, leadership of community members, fundraising, and evaluation. Another example is a city health department that's building a diverse and equitable collaborative with the purpose of examining their city's community health improvement plan to ensure that populations are represented in an equitable way. And finally, there's one city currently completing the final year of its first CHIP and developing its second CHIP. And through this funding, they're really working to strengthen the community engagement aspect of their community health improvement planning process. Next slide is the last of the 3 funding opportunities, which is healthy aging. So healthy aging, though it does include the focus on policy systems and environmental changes like the other 2 funding opportunities, it also has its own distinct focus to improve physical, social, and economic conditions for older adults in Massachusetts as they age. So here we depict the 8 domains of age-friendly communities. These were identified by the Governor's Council to address aging in Massachusetts, and they include transportation, housing, social participation, communication and information, civic participation and employment, respect and social inclusion, community support and health services, and outdoor spaces and buildings. So we wanted to highlight these and also recognize that these are interconnected. So you might be interested in focusing on one or multiple. And one other thing we'll mention is that though you can address any of these areas through the Healthy Aging opportunity, we are giving particular focus and priority to those that address transportation and housing. And Healthy Aging awards can range from $10,000 to $100,000 per year for up to 5 years. And so lastly, on this next slide is a few examples of our funded healthy aging approaches. The first one is conducting a health impact assessment on policies and practices that affect the ability of people, older adults with a criminal record, to secure housing. The second one is creating and disseminating a guide that promotes inclusive age and dementia-friendly practices, and the overarching goal to impact culture change to lead communities to consider the needs of older adults more thoroughly. And the final one is addressing barriers to safe walkability in a region through policy advocacy, education, and environmental changes as well. So with that, I'll pass it to my colleague Chen Chen to share a little bit more about the application process itself and some key dates and things like that you'll need to know if you plan to apply for the funding opportunities.
Hi everyone, my name is Chen Chen. I'll be talking about the grant making process and the next steps for the application. So first, we're talking about the grant making process. So today we're in the first step, funding opportunity announcement. And during the application period, we will offer application support, start from May 11th to June 17th. The application deadline is on June 17th at 11:59 p.m. Eastern time. Application status notification, you will receive that notification 4 to 6 weeks after deadline. And then the grant will start in August 2022. Now we're talking about eligibility. So in order to apply for the MA Community Health and Healthy Aging Funds, you have to be a Massachusetts-based nonprofit 501c3 organization or groups with a 501c3 physical sponsor, quasi-governmental organization, and municipalities. In addition to that major requirements, for this round of funding, the fund will prioritize funding support to communities outside of Boston that have not historically and routinely benefited from the previous local DON community health funding and have high rates of health inequities. Strategies may focus on geographic or population-based communities at the local, regional, or statewide levels. The fund will also accept applications from agencies and organizations geographically based in Boston who are interested in doing health and racial equity works statewide or in community outside of Boston. If you're looking for more information about the local DON community health initiatives within Boston, feel free to email us and we can get you connected to the appropriate resource, and we will be sharing our email address at the very end of this presentation. Addition to the eligible criteria, here are a few additional priority populations for this funding cycle. One is the community-based organizations where staff and leadership are reflective of the population they serve. Second, population are widely represented in the current awardee cohort, including one, groups disproportionately impacted by COVID-19, and including Black, Latinx, Asian, and tribal indigenous populations. People for whom English is not their first language, people with disabilities, people who identify as LGBTQ, and people with mental illness and or substance use disorder. Groups located in and serving Barnstable, Norfolk, Plymouth, and Bristol counties, the Merrimack Valley, and Southern Worcester County. Groups addressing social determinant of health, areas of education, employment, and violence trauma. So now let's talk about how to apply. Here is a brief checklist of how to apply for the funding opportunities. The checklist includes, first, review the request for proposal. Develop your proposal with your partners and community members. Attend application support sessions. Visit our website and submit your application through an online platform. All those lists you can find in the How to Apply page in our website. In terms of what kind of question you will need to answer to apply for this funds, there are 4 sections you will need to answer. First is organization information. Second is the basic proposal information. The third is the narrative questions, including approach, applicant and partners, community engagement. The last one is the attachments, including budget, the work plan, W-9 and tax exempt documents. So there are 3 narrative proposal formats that you can choose. Depends on which one you want to use. There are narrative and slides and video. If you choose to write a narrative, you can submit a Word document with maximum 7 pages Word document. If you choose to do a PowerPoint slide, you can submit maximum 20 slides PowerPoint. If you choose to do a video interview, you can submit a maximum of 15 minutes video on YouTube. So we want to let you know that your proposal will be assessed based on 4 major criteria. The review committee will be looking for these 4 criteria when they review your proposal. First one is equity. Demonstrate that the approach is addressing a geographic population experiencing high rates of inequities, and that the approaches are community-led, particularly by population experiencing inequities, etc. Second, impact. Demonstration of logic connecting the approach to addressing the root cause, social determinant of health outcome. Third, collaboration. So demonstration of multi-sector partners with diverse perspectives. The last one is feasibility, likelihood of resources supporting success. Now we're talking about what's the next steps. As we have mentioned before, we will be providing application support during the application period. The application support includes a drop-in style office hours, and you can come in and ask questions, and also some training sessions. Here are 2 calendars, shows all the application support we will provide. We will also drop a PDF version into the chat. You can click each event, and each event is linked to a Zoom link. You don't have to register any of those. You just click the link, you can join our session. Besides those events, and we also offer funding stream office hours. You can choose which one you want to join based on your interest. The program officers will, from each funding stream, will be there to go through all the details of each funding stream and also answer your questions. None of those office hours none of them are mandatory, so you can just choose based on which funding program you are interested. For healthy aging, this will be held on May 11th, 2 to 3 p.m. For the community health improvement process, CHIP funding stream, this will be held on May 12th, 3 to 4 p.m. Policy system and environment funding stream office hours will be held on May 16th, 10 to 11 a.m. So we ask you to visit our website. This is the one-stop shop where you can get all the information that is in our request for proposal, as well as frequently asked questions will be hosted on this website as well. There is also a resources section, and you can see here, and you can find all the materials that you will need in our website. Before we wrap up, we wanted to make sure you have our contact information. We have set up a general information account that you can send me your questions. For this funding opportunity, you can use machha@hra.org. Thank you so much. Now I will transfer to my colleague Elliot for the question and answer session.
Hi, everyone. Thank you so much, Chen and Emily, for sharing some of that information. And once again, we do want to remind everyone that after this webinar, we will post the FAQs online so that you have this information as well. There are a few questions in the chat. And so what we will do is we will pose some of those questions, and some of them we can answer online too, if you would like. We'll have that available written online as well. The first question was, is food insecurity an area that we fund? And so I'll answer this one. And the answer to that is yes, it is one of the social determinants that we do talk about as well, but it needs to be addressed in terms of inequities related to that work is where we would be for that one. Another question that we received was, does the organization need to be located in those high need communities? And so I don't know if one of my colleagues want to respond to this one, or I can as well.
Hi, Althea, and hi, everyone. My name is Jennifer Lee, and I work, I'm fortunate to work with the team at HRA for the funds. I'm happy to take a stab at answering that particular question. I might want to bundle it with another question that's similarly thinking about geography. So to the question around, does the organization need to be located in high need communities? Generally speaking, we encourage in your application that you're really highlighting for us, importantly, as we shared in the slides that we covered, how your approach would seek to help populations either demographically or geographically defined that are really experiencing inequities. And so whatever supporting information you can provide that really lead to demonstrating high need, generally speaking, is really welcomed in your application. There was another related question around how are areas with high rates of health inequities determined? And is there a list of communities ranked according to health disparities or other criteria? What we would encourage here is that in your application, we welcome a wide range of supporting information or data, and importantly, including feedback from the local communities that you serve, really defining those health inequities among your population. There's no sort of prescriptive sources that we have to definitively define that information needs to come from certain sources. And so we welcome what you're able to offer in terms of supporting information from a wide range of sources that you can offer. I'll turn it back over to Albiet to field some more questions and sort of share with us a bunch more that have come through. Albiet, you're on mute, just pointing out.
Thank you. One other question that came up, we actually just answered it in the chat as well, is if this RFP process is by invitation only, and it is not, it is open to any organization who meets the eligibility requirements that we listed on the RFP page. And do all proposals need to cover 5 years? It's a range for 1 to 5 years, 5 years being the maximum. I'm sorry, go ahead, Jen.
Oh, I was just going to chime in. Thanks, Sylvia. We had a question around whether colleges and university personnel are able to apply as principal investigators, or can they collaborate with nonprofit and or municipalities or tribal communities. We would encourage that college institutions and personnel do the latter scenario, which is to partner and collaborate with nonprofit and community-based organizations, as well as municipalities and tribal communities for their approaches. Another question was also asked around whether these particular chat questions would be shared or recorded. And we're actually going to take the questions in their generalizable form and include them into a frequently asked questions document that will be available on the website along with these slides and the recording.
Thank you, Jen. One other question that came up was, you listed priority counties. Will programs in other counties not be accepted or considered? And so these areas are prioritized. However, it does not preclude others in other counties or towns to apply for the for this grant. However, priority will be given to those specific counties and populations that were called out specifically in the RFP. I'm sorry, and we're just trying to catch as many of these questions as we possibly can. Can a 501c3 serve as a fiscal agent for multiple proposals? I'm looking to my colleague, Jen, who is nodding that that is correct.
Yes, yeah, they can. And albeit if it's all right, I'll chime in here because I've picked up a few more.
Yes.
Apologies, now I'm trying to scroll. If we can think of other organizations, oh, I apologize, that one was invite only, that was addressed. Can the same organization apply for funding with different partners under different funding opportunities? So an organization can definitely apply to more than just one of those funding streams. We would really encourage, and probably based on which of those 3 funding streams you're applying for, whether it's healthy aging, policy systems, and environmental change approaches, or that based on which category that they are differentiated based on the particular track that you're applying for, but technically one organization can apply for more than one funding stream. And then I'll just pick up another one, albeit while I'm here, which is with the grant pay for payroll for CHWs to work with clinical and behavioral health teams to close the gap to care with non-English speaking community patients. And generally speaking, you can certainly apply for funding to support payroll and staffing costs for CHWs. That would be an eligible cost overall.
A couple of other questions that came up is there a set number of awards that are going to be made? Or do we have a pot of money that will be awarded according to proposals? And it is the latter. We have a pot of funding that will be distributed to those applicant RFPs that are decided to and get awarded for the amount versus a set amount of people that we are looking to serve. Another question here is, would churches or religious organizations looking to do work in mental health area post-COVID-19 be eligible? And again, and I will look to my colleagues as well to add anything in addition to that, but all organizations who meet the eligibility requirements are able to apply, and mental health is also one of the priority areas in which we describe that we will that we are looking to fund for this particular area, for this particular work. And then there's one question that I'm unclear of, but I will ask, I'll look to some colleagues. Are current Strengthening the Voice of Access grantees eligible? And I'm not sure about this one, but
Albeit, I'm happy to chime in that. I may be familiar with that as a separate funding stream from a different foundation or funding entity altogether. So if your question is whether you can apply to this, generally speaking, I think this is a different funding source made possible by the determination of need requirements passed by the Commonwealth. And we shared earlier a set of other eligibility criteria, which if you feel your organization aligns with those criteria, you're certainly welcome to apply for this. We don't specify sort of any requirements around other types of grantees that are not the same as this particular funding stream, but please let us know if that addresses that question and if there's any follow-up that you may have. And then I believe there was another question. Do we write the grant requesting funds for 1 year, or should we budget with a 5-year request for funds? We would say it's really up to you, and it's truly in that range, depending on which funding stream that you are applying for, anywhere within the range of 1 to 5 years. So it literally could be a 1-year request, 2-year, 3-year, 4-year, or 5-year request. And we encourage that you think about what the needs are for your particular organization or partnership and lead and sort of structure your request based on the amount of time that you're looking for funding for. But anywhere within 1 to 5 years is the range that we have available.
there is also another question for in healthy aging. It's noted that transportation could be a primary focus. Can you elaborate on this? And I'm assuming that the question is asking for the rationale behind why transportation. And if so, transportation is one of those pieces that is seen as impacting the health in terms of access to services, access to care as well. And so that's part of the reason that transportation is included in here. Additionally, for the healthy aging piece, EOEA has specific documentation, specific literature that they've conducted and work that they've conducted over a period of time that they encourage people to look into as well to help inform the work, to help inform the proposal. And so that is also available online for folks who are interested in hearing a bit more about that work. And I don't know if there's anything else anyone would like to add to that. If not, we'll try to catch as many of these questions as we possibly can. Are proposals that have leveraged funds from other sources considered favorably? We do not look at other funding sources as an additional point or more so than another organization or entity or collaborative who does not have that provided to them. So that is not considered an additional bonus or favor of any sorts, if there are those. It certainly helps push the work and move the work along, but it is not seen as something with additional points for it.
We have a few, go ahead, Albia.
No, go ahead, Jen, sorry.
I was going to say we have a few questions just on clarifying the sort of amount of time and the funding amount. So I think there was a question around, does the amount change if you do less than 5 years? For example, for 5 years, you can get up to $500,000, but can you apply for $500,000 for 2 years? In each of the slides that Emily covered recently with some of the examples, we specified the total amount of maximum funding per year. So we would recommend adhering to each of the 3 funding streams has a differing sort of maximum amount level by the year. And that's kind of what we'll look to. So for instance, if it's up to $100,000 per year for 5 years, in any given year, the maximum amount that you can apply for is $100,000. So in this case, that example would mean that if you applied for less time, you couldn't increase it to the total maximum amount, if that makes sense. It's really driven by the maximum amount per year that you can apply for. And then if the proposal is submitted and its timeframe is for 5 years, but for some reason it's not accepted, is there a possibility that it will be accepted for a short amount of time? And definitely that makes sense. The funds do have the ability to, in reviewing just based on the amount of resources available, certainly fund for less amount of time or less funding than originally requested. But that would be determined on a case-by-case basis. And if that is an outcome of the decision, we would communicate that with the applicant organization and discuss what that looks like overall.
There is one question for those new to CHIP. Are organizations creating our own plan or reacting to specific CHIP plans that already exist for specific communities? And I will let one of my colleague Emily respond to that.
Thanks, Albia. I saw a few questions related to CHIP, so I'll try to kind of answer a few of them all at once. I also want to mention for everyone, we do have those funding stream specific office hours coming up as well, in addition to some documents on our website that have more information about each funding stream. This was really a chance to provide the high level info. So just want to direct you to those two places in case you want to learn more about the funding streams. But just briefly on the CHIP question. So first of all, high level definition of CHIP for the person who asked and others who may be wondering is long-term systematic efforts to address public health problems based on the results of a community health assessment activity and community health improvement process. And that typically involves a plan that's updated every 3 to 5 years. So it's kind of the high level definition of CHIP. And then I think to the question you just stated, Albia, organizations can be engaging in any step in that process again. So you might be involved in the implementation of strategies to address public health problems, or you might be involved in actually developing the CHIP plan. So again, we'll talk more about that in the specific sessions. And if you have more questions on that, we're happy to answer them individually as well. And then I'm just checking, I think I saw 2 more CHIP questions really quickly. One was about whether we'd funded Chenaz in the past. We are currently funding Chenal 9, and you can find more information about current grantees on our webpage. And then I also saw someone wondering, they're a fiscal sponsor for multiple Chenaz. You can apply separately for both of those Chenaz as a fiscal sponsor. So I hope that answered some of the CHIP questions, but happy to answer any others that come through as well.
And there are a few examples of CHIP processes or plans or awardees in previous that for folks to note if they're looking for examples, as well as healthy aging and policy system and environmental changes as well. Okay. One other question that came up, do you encourage contacting the awardees in the previous round to get a sense of their experience and how they've used their funding and their experience of HRIA support? Is part of addressing health disparity and equity, the invisible aspect of social capital and access. And certainly connecting with other previous awardees, they are all listed on the website. People most certainly can choose to do that. It is not necessarily, we don't necessarily have folks' contact information listed, but you most certainly can see the work and choose to proceed to connect with colleagues as well, whether they are previous year awardees or if there are other organizations that you are looking to connect and collaborate with. That is something we certainly do encourage for folks to do.
Just chiming in here with a few other questions as we're hopefully getting to all of them. And if you did ask a question earlier on and we might have overlooked it in the flurry, please keep on throwing it in the chat box as we'll pick it up. But another question was, how do you determine a healthy outcome? Are you looking for a deliverable that the proposal will produce at the end of 5 years? And there we would say we are open and welcome your thoughts on what are a wide range of outcomes you hope to accomplish as a result of putting into play your implementation and your activities, whether it be over the next year, 2, 3, 4, or 5 years, whatever kind of time horizon you're looking to apply for funding for. We're not looking to be prescriptive on like it's an actual sort of thing that you might hand us, but broadly speaking, outcomes could really look and feel differently, whether they include process outcomes as you think about policy systems and environmental change approaches that you're looking to actually have an impact on and change, as well as outcomes that may really emerge from communities and populations that you're looking to support in your approaches. So we would encourage and welcome a wide range of how you think about your outcomes if you were to receive funding through this opportunity. Another question around, are proposals that have leveraged funds from other sources considered favorably? I think generally that is always a welcomed aspect about your project. If you happen to already have other sources of funding in the pipeline are already committed, we welcome that information. We're thinking broadly about a wide range of organizations. So having leveraged funds from other sources doesn't automatically provide extra favoritism in that regard, but it's welcomed information that if you'd like to include it in your application proposal, that certainly is helpful information. And then COVID has impacted our ability to do work in community and to spend funds in a timely manner. Is that a factor that we should note in our proposals? And we'd say absolutely yes. We know that we continue to navigate a global pandemic around COVID that has impacted a number of factors from workforce to capacity to bandwidth. We welcome whatever information you are interested in including. And of course, as you think about the time horizon, to feel free to include activities or information of what you would envision your 5 years or 4 or 3 or 2 or 1, whatever the time horizon is, again, what you think is manageable and accomplishable within that time frame. So we'd welcome that information overall.
There are a couple more questions that came in. One that I'm interested in hearing from my colleagues. If an organization has a fiscal agent, can the organization, if an organization has a fiscal agent, can the organization apply with the fiscal agent and then would the fiscal agent be able to apply on their own? Or does it have to be one application?
I'm happy to chime in. So in that scenario, you can have 2 separate applications. We would just encourage that they're for separate asks and requests, but you can absolutely have 2 separate applications. It does not need to be merged into one.
Thank you, Jen.
And I'm not sure if it's just me. Oh, Albia, you're back. There was a bit of a freeze there.
Okay. The question was following up on the transportation question earlier on, and just looking to see if there are any specific work studies from EOEA that's relevant to transportation. And
what we might be able to do, albeit into the person who asked that particular question, is refer back to the website in which we list our past awardees under the Healthy Aging funding stream from our initial cohort that was awarded back in 2020. There are also additional resources under the Healthy Aging funding stream that really cull together different sources of information supporting and informing the Healthy Aging funding opportunity. So a lot of that information is contained within the website that we've been sharing in the chat box. And if after reviewing that information, if you're still having some emergent questions, please feel free to join us for the Healthy Aging Office Hour, where we can help to address that. I think that there was one other question I saw kind of a little higher up that maybe we might have overlooked, which is, could a proposal receive more than $200,000 a year if it covers multiple geographic regions and counties? I think for that, we would just, again, drill back to say that each funding stream has a maximum amount of money for the year that you're, for a singular year that you're applying for. And we specify that within the RFP and other information. And that's sort of the maximum cap that's set. So if it's specified that a proposal can be a maximum of $200,000 per year, even if it does impact multiple geographic regions or counties, the $200,000 would be the maximum amount that we could fund, recognizing that you may be covering a larger swath of a region or area, but it still has to hit that maximum amount of money. So hopefully that's helpful, and let us know if there's more information that's necessary or helpful to you.
Just scrolling through other questions, trying to see if there's anything else that we missed from the top. There's a question, are current grantees eligible to apply? And I'm sorry, that is one of the questions that was asked before earlier on as well. And the answer to that is current grantees are not eligible to apply for this cycle, this funding cycle at the moment. If you're currently working with us through cycle 1, you are not eligible to apply. However, as I mentioned previously, I want to share again with everyone that there will be other funding opportunities from the funds that will come in the next few years. So we are looking to continue with the program and sending out other grant making cycles that will, for those who are not eligible to apply this time around, or to those who just simply aren't able to apply during this time frame. I'm just looking to colleagues to see if anyone saw any other questions that we've not yet responded to. One question for healthy aging, is that aging for a specific age group? And that for healthy aging, it's specifically looking it is specifically looking to those doing work related to 55 plus communities or age groups. Do we have Zoom links for the office hours? All of the information for registering for the next office hours, those are available on the website for folks to register as well. And Chen also just placed those in the chat for folks as well. And again, we do want to emphasize for everyone that if we were not able to get to your questions in the chat today and respond, that we will be working towards ensuring that we have those on the FAQA and more generalizable responses to those as well. And there is one question, excuse me, as I'm One question is your community, if your community is predominantly white, is that a disadvantage for the racial equity aspect / focus of these funds? And the answer to that is no, but I will also open it up to my colleagues to share additional information related to that.
I would just add to that. I think we, as we shared in some of the earlier slides, we recognize that there are a broad range of inequities that exist for populations across the Commonwealth. And so we welcome, especially if your community is predominantly white and you know, how that inequities exist for your community and for your population, including information about how you would drill down to the root causes of those inequities in your particular request and submission.
Right, we're scrolling through the questions. And again, we just want to thank everyone for taking the time to meeting with us today. We really do appreciate the opportunity to have so many of you join us this afternoon. And again, we do want to emphasize that this is not the last opportunity or the chance that you get to ask us questions. So if something comes up later, please feel free to utilize the email to ask us questions. Additionally, we will have the office hours that my colleague Chen Chen talked about, in addition to some opportunities for workshops related to helping people kind of get ready for the application, as well as just regular opportunities for communications. So we have examples of each of the funding streams that are available to you online. Please feel free to connect with us and continue to communicate with us offline, even though we're unable to, even if we may not be able to answer all your questions, or you think of something, of course, the minute you hit end and then you realize it was a really important question that you had to ask. Once again, thank you all for hanging in with us today and asking all of these questions. And we really appreciate this opportunity. And again, not the final time we'll be in communication, but just want to thank you all. And I don't know if any of my colleagues wanted to add any last minute points before we end.
Thank you. Great webinar.
Thank you all so much. We will be in contact soon. Thank you. Enjoy the rest of the week.
You too. Bye-bye.